Monkeypox is a disease of close contact and the risk to the general public remains low, so says the head of the World Health Organization's Smallpox Secretariat, after European nations, the United States, Canada and Australia confirmed or suspected around 200 cases, with numbers expected to rise as more medical practitioners now look for signs and symptoms. Health officials say that it was unusual for the world to see this many cases of monkeypox outside of Africa's central and western regions, where the disease has become endemic.
The outbreak has quickly spread across Europe, with a limited number of cases being investigated in Canada and the United States, with President Joe Biden saying it is a concern and that its spread would be consequential.
This outbreak is not typical because we usually just see monkeypox in endemic countries. There are countries in Central and Western Africa where this is a known and recognized infection and disease. However, we have seen over the last 5 years 9 cases of imported monkeypox, that is to say, monkeypox detected in travelers from Nigeria. Over the last 5 years, we have seen just 9. So they were all linked to travel to West Africa, and that's why these cases now appearing in most regions and many countries of the world is a completely new situation.
Dr. Lewis says monkeypox is transmitted by close face-to-face or skin-to-skin contact, and that the pattern of infection they are witnessing remains the same.
As we've mentioned, monkeypox is really a disease of close contact, and so the risk to the general public remains very low. However, direct contact with a person who may be infected or who has a confirmed case of monkeypox means that the risk is obviously higher. So what everyone needs to know is that the risk in general is low, and we shouldn't be concerned. However, if you are concerned about any particular symptoms you are feeling, then please do consult a healthcare provider and let them know what your concerns are. In addition, if you have been diagnosed with a case of monkeypox or you are concerned that you may have this, then the important thing is to isolate yourself. Do not have physical contact with other people.
The symptoms include fever, headache, muscle aches and swollen lymph nodes, in addition to patients also developing a rash, which begins on the face and quickly spreads to other parts of the body.
The symptoms of monkeypox are described quite classically as being a rash that is preceded by a fever and feeling slightly unwell for a day or two. And then the rash is a typical rash, which goes from a red rash to vesicles, little blisters, to pustules, and then to a crust, and then the crust dries up and falls off. This is your classic situation of monkeypox, the classic description. It also usually starts on the face and progresses to the palms of the hands, the soles of the feet, and the rest of the body. What we're seeing in the current outbreak of monkeypox in countries that are not typically seeing these cases is that many cases still do present this way. Many others, however, are presenting with a rash that is more limited in region in the genital area and the perineal area. This is not unheard of before. It's just being described much more commonly right now.
The UN's health agency says it has established an incident management team which is responding in a coordinated way to the outbreak. WHO says it's been familiar with monkeypox for 40 years, ever since the eradication of smallpox was declared in 1980, calling it a priority pathogen of the last 4 decades. They indicate that technical guidance is being posted online for countries and other interested parties on surveillance, case investigations, contact tracing, clinical guidance and infection prevention. They are also providing information on immunizations, vaccines and treatment, while people coming into contact with monkeypox are being advised to quarantine for 3 weeks. Sherwin Briceby's SABC News, New York.
Well, the first case of monkeypox has been identified in Scotland, bringing the total number of cases in the UK to 21. British health officials are also now advising those who've had close contact with a confirmed case to self-isolate for 3 weeks. Giles Gibson reports from London.
Well, authorities in Scotland say the individual who's been diagnosed with monkeypox is being treated in line with nationally agreed protocols and guidance. This latest confirmed case comes after the UK Health Security Agency, or UK HSA, changed its guidance for close contacts of somebody who is a confirmed case of monkeypox. They're saying that these close contacts should avoid any travel, that they should also sign up to contact tracing, and that they should avoid certain groups of people, including the immunosuppressed, pregnant women and children under the age of 12. Health officials are also saying that close contacts should receive a smallpox vaccine, which could help protect them because the two viruses are very closely related. Meanwhile, Dr. Susan Hopkins, who is the Chief Medical Advisor at the UK HSA, has confirmed that community transmission is now taking place in this country, which means they are identifying cases who have no link to somebody who has recently travelled to West Africa. Meanwhile, the Prime Minister Boris Johnson has described this as a very rare disease, but he says his government is keeping a very close eye on the outbreak as it develops. We are seeing small numbers of cases of monkeypox popping up, including, for example, in Germany, in Portugal, and in Spain. And while this might all sound like the early days of the coronavirus outbreak, experts are saying that the two viruses are very different. They are saying that monkeypox is a known quantity to both scientists and to doctors, and they're also stressing that monkeypox is much less contagious than COVID-19. Giles Gibson, SABC News, London.